Well, after you've had babies, your body doesn't always bounce back. Here's the mystery. How can a 7-pounder wreak that much havoc on your body? Stretch marks, sagging skin, breasts that have discovered gravity, and excess fat. And no matter how much you exercise, your body still won't snap back. It can all be fixed in a few hours. Here to tell us how is Dr. Scott Yarish from Yarish Plastic Surgery and Renew, UMD. Also joining us is his patient, Debra. Good morning. All right, I ran into you in the elevator because he's my neighbor, and I asked you what you love doing best, and you said, well, I love the tummies, but then I love this, but then I love anything that makes somebody feel whole again.
Absolutely, absolutely, and that's what we're talking about. I want to talk about mommy makeovers today, because there's nothing like having you have a baby, one baby, 2 babies, 3 babies, or whatever it is. Your skin's never going to go back to where it was.
Yeah, but it can happen.
It can happen.
Yeah.
But you can have a husband that tells you just need to do more crunches, right? Yeah. And you've got the skin.
You mean the ex-husband that tells you that you need to do more crunches?
Yeah.
or the husband who buys you this for the Mother's Day makeover, right? Yeah. Okay, what was happening with you, Debra?
What was going on with me is I gained a lot of weight in pregnancy. I'm not normal, and I did have 3 C-sections with, they were all close to 10-pound babies. Yeah. 8 pounds, 11 ounces to 9 pounds, 11 ounces. Wow. And so there was no coming back from that, you know, and so
all those children need to give you great Mother's Day gifts like, for the rest of your life, right? But it's just something that naturally happens to the body, right?
Absolutely, absolutely. And some people can just work out and get their way through it. It just depends on your metabolism, your genetics, etc. But, the average woman maybe gains somewhere between 25 and 50 pounds. And I think Debra...
I gained over 100.
Wow.
She gained a lot.
All right. Yeah.
So what happens? Everything stretches, everything goes down. And
there you go. You have a whole body that you didn't have before you had that baby. Okay, there's all kinds of things that can be done. You don't do a one-size-fits-all. You look at the person and you want to see what aesthetically makes sense.
Exactly. Every patient is different. My great mentor, Dr. Tom Biggs, taught me this one adage. It's no key fits every lock, right?
Right.
So no operation fits every patient. But there's a combination of things that we do for the mommy makeover to get rid of most of the skin, all the extra skin basically, tighten the muscle, lift the breast.
I'm going to stop you right there. Can you say tighten the muscle? Sometimes when people see tummy tuck, they think you just pull the skin down and then sew it on up. But after you've had babies, those muscles are distended.
Right, the muscles are distended, and not only that, they're split apart. And so I've had women who, if they got on the floor to do a sit-up, couldn't even sit up. They'd have to.
Yeah, that was me.
Oh, look at that. This is you right here?
That was me.
Wait, no. Oh, wow.
Yeah.
These
that's
are others.
That's some other girl, but look at that. Before and after is amazing.
But I've had patients that would get on the floor to do a sit-up and they couldn't even sit up.
Yeah, me. I couldn't.
Yeah, she'd have to roll over on their side and get up
because you couldn't
off
use
the
those
floor.
muscles. So what you do in a tummy tuck is that you literally sew those muscles back down.
Sew the muscles back together. That's what really flattens the tummy. And
like a corset, a built-in corset.
Right, a built-in corset. It's a good way to put it.
Yeah.
And then, of course, we take off all the extra skin.
Yeah.
Make it real tight.
And then, of course,
give them a pretty new belly button.
Yeah.
Can the TV audience see those photos? Are they looking at those photos too?
Yeah. Okay, so liposuction is one of the other things that can kind of get some of that extra fat.
Right. Look, in Debra's case, she was like 55 pounds overweight, or over her ideal weight. And so, what do you do with that? Well, she had done all the diet. She'd done the exercise. She had basically hit the wall and couldn't do any more.
That had to be frustrating.
So, it was super frustrating. But after the surgery, it got me the motivation to go, and I actually lost 50 more pounds after.
Okay, this is you right here. This is you.
That's me.
Wow. I don't know if we have a side view of that, but there we go.
Yeah.
There's a side view.
Okay.
But so a mommy makeover basically involves 3 things. The breasts, either reduce them if they've gotten too big, lift them and put an implant in if they've gotten too small. A lot of women lose a lot of breast tissue.
Yeah.
If you're like a B or C cup, you're going to lose breast tissue when you have a baby.
Right.
Unfortunately, this is a freak of nature, but unfortunately, if you're already a D cup and you have a baby, they usually get bigger.
Yeah.
And so we do either a reduction or a skin lift or implants, depending on what you need, plus the tummy. Get rid of the C-section scar if there is one.
Yeah.
Stretch marks from the navel all the way down. We get rid of those.
And we're looking at here how you have the breast lifts there, and so you can see that they're not just kind of hanging.
Right.
So reduction, you can do a couple of things. You can either get a reduction or a reduction and a lift, right?
Right.
Yeah.
Now, does a reduction or a lift, do they always include breast implants?
No, depends on the size of breast you want. If you're 5'5" and 125, 30 pounds, usually you've got very small breasts that have sagged.
Yeah.
And so most of those women want an implant.
Okay.
But some want a reduction. It just depends.
Yeah.
No key
Breastfeeding
fits
has
every
a lot.
lock, remember?
Yeah, that's right. No key fits every
yeah,
lock.
that's
Okay,
right.
now fat. We act like fat is all bad, but there are times when fat can be good if it's in the right places. There's a thing
I'll
called
tell you
fat
what,
transfer,
I'll
right?
tell you what, that's a big deal because as much as the breast and abdominal surgery take off the skin, et cetera, and raise and lift everything else, it's really the liposuction that gets the size down.
Right.
Like I can take somebody like Tamara, maybe she was an 18, and just with liposuction go down to like a 12 or 14.
Wow.
And then
And contour as well, because I saw in the picture there that you had a nice waist, so you had that hourglass waist as well.
It's all sculpting.
Yeah. All right. So after you had it all done, how did that impact your self-esteem?
Oh my gosh, it was amazing. I had more energy. My husband was happy. I mean, he was like, I mean, he didn't care either way. He didn't care either way if I did it or not, you know. But afterwards, he was just like, wow, like your self-esteem is back.
Yeah.
You had the breast lift and augmentation, a tummy tuck, and liposuction. So it's okay to have all those things done at the same time?
Always. That's a real common procedure for us
Yeah.
to do. And you know, I see several of my patients have lost a lot of weight, and so if they've lost a lot of weight, then they've got arm issues,
sagging
and
arms and, yeah.
thighs, and we'll do all those at one sitting. Now, if we do, as long as our patient is healthy, but if we do a lot of procedures, we might keep them overnight in an overnight stay facility. But most people go home after the surgery.
Yeah. What was your recovery like?
Mine was amazing. Like, people ask me, how do you do it? Was it scary? You have so many children.
Look, if I'm going to look better, I don't care what I do.
Yeah, I said, hey, he put me up in a nice hotel for, a night with a nurse?
With a nurse,
personal
yeah.
nurse. And then at the time, my babies were 1, 2, and 7. So it was totally doable, and the pain was fine.
And so this is one of those things that you would do after you're done having children?
Yes.
Yeah.
Because you don't need that fourth baby to mess things up.
No, but that happens too.
Yeah, that can happen.
We can fix that.
Yeah. All right. I mentioned that, whether you have to have breast implants or not, and you answered that question. One of the other questions that people ask a lot is, do I have to be my ideal weight in order to get this done?
Ask Tamara.
I was not my
Yeah,
ideal weight,
yeah.
but I was so.
But you'd already
over
done
it.
everything you could do.
Yeah, and I was just getting discouraged, because that skin that's hanging, you saw the skin on the pictures, and so without that coming off, you're never going to look good in an outfit.
Right.
But so that's just my personal preference.
So she was about 50 pounds over her ideal weight, and we talked about diets and what have you done, and she had done everything, hit the wall. She said, okay, well, let's do this, because more than half of my patients that are in that situation, they'll do what Tamara did.
Yeah.
They'll do the surgery, lose more weight, and she just lost it and kept it off.
Yeah.
It gives
You
so
have
much
30 years of
encouragement.
experience in this.
Yeah,
and so you've
yes.
seen technology change, you've adapted to that technology. Outside of doing the actual surgery, because sometimes that's what it takes. Nothing else is going to make it happen. You're going to have to literally cut it out, get rid of it, sew it down, the whole bit. But you also have the medical spa,
Right.
which we can do all kinds of procedures today that don't require surgery.
Yeah, we have some great procedures there. For one thing, we use the medical spa for all of our patients. Tamara, I'm sure, went in and had
Lymphatic drainage.
lymphatic drainage and ultrasound if there are any irregularities, et cetera. Things that'll make you heal faster. We use vitamin programs, et cetera.
Yeah. Cool sculpting, vanquish me.
Sculpting. If you just have a small amount of fat, we'll just use cool sculpting to dissolve the fat. It's an awesome way to get rid of fat without surgery.
The laser treatments that you gave me, I don't have any scarring.
And the laser.
Oh, really? Because that's a big deal.
No scarring.
Yeah, that's a big deal. That's amazing.
Everybody that has surgery at our facility gets laser treatments. We do scar tapes. We do everything we can to get rid of the scars.
Yeah.
Now, you're not going to do this surgery generally without having some scars. Most
Right.
people are going to see them, but they're not
If
severe.
you're showing.
If you're showing. If you're showing, yeah.
And there's something new called M-Sculpt, which is really interesting.
It's unbelievable. Unbelievable. That's what we were talking about earlier before the show. It creates a vibration. It's a magnetic resonance machine. It creates a vibration in your abdominal muscles, your thighs, your buttocks, wherever you do it, like 20,000 times a minute. And it's like it's 20,000 contractures.
So it's like you did
in a minute.
20,000
It
sit-ups or
hurts.
something.
Like, it hurts.
Like you're
You're
really
sore. I
working.
did it, yeah.
You feel like you've done like
Yes.
100 sit-ups like in about 3 minutes.
There is someone on our staff who actually did it on her booty.
Oh, really?
Yeah.
And I'm not going to call her name, but it was a little saggy, and now it's
Oh, really? Is she wearing a purple dress? Is that what
No, it's not me. No, it's not me. It's not. I need to go. I'm going to go after I saw what she did. But yeah, so
really,
all kinds of things with
lifts,
technology. It's amazing.
It doesn't make your booty that much bigger, but it lifts and tightens.
Yes. And the cellulite just
Yeah. Okay, since you live in my building, I just wondered, can you bring like that lipo machine home?
You know what? Give me a date, I'll do it.
Yeah, give me a date and you'll do it. All right, Yarish Plastic Surgery and Renew You MD have a special offer for Great Day viewers. Get 20% off non-surgical body contouring such as Cool Sculpt or M Sculpt at Renew You MD. Just be sure to mention Great Day Houston when you call. To book your consultation, call now. The number is 832-856-4281. 832-856-4281. We're calling it a mommy makeover, but if you're not a mommy but you still got some stuff you want to get rid of, he can get rid of it. For more information, log on to yarishmd.com. Thank you very much.
Thank you.